to pandemic COVID-19 in Mobile County. So I'll give you the counts as of about 10 o'clock this morning from various sources that are put together by our Public Health Information Officer. Worldwide, we are approaching 3 million confirmed cases of COVID-19 with just over 200,000 confirmed deaths. In the United States, reporting 967,000 cases of COVID-19 with nearly 55,000 deaths. In Alabama, 6,429 cases of COVID-19 with 219 deaths. And Mobile County this morning was reporting 925 confirmed cases of COVID disease with 41 deaths. I've gotten lots of questions about people who have noticed that the Mobile County has more cases reported than any other county in the state. And why do I think this is the case? Well, one is we have an outbreak and we have community-wide transmission ongoing. And yes, we are, asking people to sort of source control, asking you to help us control transmission out there in the community by continuing to stay at home and protect yourself and stay at home if you're sick. But we also have cluster investigations going on in several congregate settings around the county in about 6 long-term care facility and in 1 detention center. And in response, or trying to respond and control transmission within those facilities, we are taking some very aggressive measures by recommending that these facilities greatly expand the PCR testing for COVID-19 in their staff and in their residents, because we know that there is quite a bit of asymptomatic infection out there. People who have no symptoms or who have not yet developed symptoms or have mild symptoms that can spread COVID to others by close contact. So because of that, we have ramped up and recommended widespread testing at these facilities so that we can identify healthcare workers and residents who are infected and quickly get them isolated so that we can reduce transmission. So that is definitely adding to the number of confirmed cases and confirmed deaths. In Mobile, we currently have 41 COVID-19 related deaths. I wanted to read a couple sentences from a statement in our daily dashboard. A scientific brief released by the World Health Organization cautions against the use of COVID-19 antibody tests as immunity passports. The WHO brief states there is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection. We at the health department are concerned that people who have obtained a positive COVID antibody test may not continue to comply with public health guidance because they think they're immune, and therefore they are increasing the risk of transmission in our community. So again, there is no evidence that people who have antibodies are protected from a second infection. And WHO and Centers for Disease Control will continue to look into that and let us know when they learn more about immunity from COVID-19. All right, let's see some more detail on our patient characteristics. Again, we now have over 900 cases of COVID-19 disease in Mobile County. 106, or about 11.5%, have been hospitalized, and about 4.5% have died with COVID-19. So that calculation, 4.4%, is sometimes considered an attack rate. We also sometimes use the word mortality rate. These things usually are used interchangeably, but we right now are reporting the proportion of our cases that have died among all of our COVID cases, and that is about 4.5%. Sometimes deaths are and cases too, are reported per capita. So you may see a death rate or a mortality rate that's per 100,000 people, so that you can more easily compare our case count, hospitalization, and death count with other counties and other jurisdictions across the U.S. We still are seeing about 25 or 26% of our cases are occurring in people who are 65 or older. We do have a small number of COVID positive children, so 7 so far that are in the 0 to 4 age group. Still, about 60% of our COVID positive cases are female, and 40% or 41% African American, with about 29% white. I'll show you guys, the map really hasn't changed much, the NITSNI map, by zip code lately. We're still seeing sort of most of the cases in these highly populated areas of our county, with fewer cases spread throughout the county. I was asked this morning by a reporter, do I worry that people who are in other parts of the county aren't getting tested, and that's why we don't have cases there? There is probably some influence on the number of cases because we have limited availability in some of the more rural areas. But I just want to remind you that, every week we see more and more testing sites open up. And last week, the Family Health, our primary care division of the health department, opened their drive-through testing clinic to anyone who met the criteria and had an appointment. So, we have thankfully been able to contribute to widening testing. We're hear that some CVS stores are beginning to develop testing. We hear that at Walmart and Saraland may stand up testing as soon as later this week for people who qualify. And then we've seen some things from our federal partners, from FDA and others, where some companies are working on a self-administered test for COVID-19, so that if you have symptoms and you talk to a healthcare provider and the provider orders the test, perhaps the test might just show up in your mailbox and you collect your own specimen and then send it back, which of course would eliminate the need for transportation, but I imagine there would still be some cost associated with that. So stay tuned as we learn about more and more testing availability. We will let you know, and you can go to alabamapublichealth.gov and call the toll-free number to find out about the testing facilities near you. So just a couple of things about more detail on our hospitalized patients, since I've not given this information recently. Among 106 patients hospitalized, 11 were 24 to 49 years old, 32 were 50 to 64, and 63 were 65 or older. And again, we know sex and race of most of them. 55 were male, 51 for female, so pretty evenly distributed there. But 68 of the 106 were among African Americans, and 34% were white. So we are still seeing hospitalization, severe outcomes disproportionately affecting the African American population in Mobile County. As far as deaths, we had 41 patients who died from COVID at the time of this report. They were between 52 and 83 years old, 25 male, 16 female, 24 were African American, and 17 white. The overwhelming majority of these have underlying medical conditions. They develop symptoms typical of COVID and were hospitalized at the time of death. We know of very, very few, like in the single digits, people that have died outside of the hospital or a long-term care facility from COVID, or that are being investigated from COVID. So stay tuned on that. In the last few days, yesterday we added 25 new cases, the day before that 53, the day before that 37, before that 35. So we are still seeing between around 30 to 40 cases on average reported each day, based on the date of the report to public health. So a couple of announcements. Mobile County Health Department and Family Health will expand operations next week. Just want to make sure you have the latest information, and of course it will be made available on Facebook Live and available on our website. So let me make sure I get this right. So we'll provide an additional day of appointments starting on April 27th at the Women's Health Center at 248 Cox Street. So OB services and limited family planning services have been offered on Mondays and Thursdays. from 7:30 to 4:30 p.m. So they will now be provided on Wednesdays at the same time. So Monday, Wednesdays, and Thursdays from 7:30 to 4:30 p.m. OB and limited family planning services at our Women's Health Center at 248 Cox Street. Other adjusted schedules, our Newbern Health Center is open Monday and Thursdays, 7:30 to 4:30. And we see well babies, patients 12 months old or younger, for well child visits there. And please limit the number of family members accompanying the child to one parent or guardian in order to adequately maintain that physical distancing. Our 8 Mile Health Center, Monday and Thursdays from 7:30 a.m. to 4:30 p.m. is on 4009 St. Stephen's Road. It's open for well child visits for ages 1 to less than 5. So if you're 1 to 4 years old, you can be seen at our 8 Mile Health Center Mondays and Thursdays, 7:30 to 4:30 on St. Stephen's Road. Again, our urgent care clinic is still open at the Keeler Memorial Building, where I'm here now Monday through Friday, 7:30 to 4:30. On 251 North Bayou Street, and we're only taking sick patients there, and you have to call for an appointment, 251-690-8978. And then our drive-through COVID-19 testing facility is running Monday through Friday, 9 a.m. to 3:30 p.m. To receive an appointment, call 251-410-MCHD, or that's 251-410-6243. The person answering the phone will determine if you're eligible for testing and schedule an appointment. And again, the test is at no cost to the patient. We bill insurance for those who have good insurance and will absorb the cost for those who do not. Again, food handler cards are available online. Vital Records is open Monday, Wednesday, and Friday from 7:30 to 4:30, but we need you to, sorry, I'm trying to look to see if they still have to make an appointment. Oh, client, nope. It looks like no appointment is necessary. Just come to the downtown Keeler location, and they will allow 3 patients at a time, 3 clients at a time to come in to get the vital records. It may be a little slow today because ADPH is off for a state holiday today, and there may be a slowdown on vital records access today. But again, also remember, we have our medical triage line open, 251-690-8978 for our family health clients. For our family health clients, our prescription refill line is 251-445-8635. And then for anyone who has questions about COVID-19, you can call our information line at 251-410-MCHD or 6243. Right. I was asked a question last week, and I stumbled a little when I saw the question on my page here because I had not read it before. So I want to readdress it to make sure that I am loud and clear about this. Someone submitted a question to say if you could transmit COVID during sex. And I just want to make sure that I'm clear here that we really do not know if coronavirus is present in body fluids like vaginal secretions or semen. There's not any data to suggest that, but you are in very close quarters when you are having sexual intercourse and likely are exchanging, through kissing or sexual play. You may be exposing each other that way. And I also want to remind you that there is information out there to show that COVID can be shed in feces. So keep that in mind as well. Again, wash your hands, wash your toys, use your physical distancing when you can. All right, on to some Facebook questions. What if you work with intellectual disabilities? I think I answered this one last week, but I'm going to do it again. We have received several inquiries about people who live in group homes or group residential facilities. They may have physical disabilities, they may have mental disabilities, or health issues that and they need that group home setting to really survive and thrive in the community. We are concerned about the potential spread in these facilities. We have talked to a couple of them to try to help them maintain the best source control that they can, and trying to implement the best practices to keep COVID out of their facility. But yes, we are aware and concerned, and we are here to assist if there are any group homes that feel like they would benefit by having a consultation with the health department. So please reach out to us if you are a manager of a group home or a resident and you have some concerns that you would like to discuss. All right. Shouldn't the rapidly increasing percentage of people testing negative become a stronger indication of decline? Increased testing increases the number of positives, but also shows much higher percentage than negatives. Okay, there's a little hopefully I'm getting this right. It's a little tricky to say that the outbreak is declining because we have a larger denominator of negative tests. Because we really, it could mean negative today, when the person could become exposed and they could test positive on Thursday. So we generally, yes, it's an important stat to keep an eye on, but it's not super reliable, because we know the negative number of tests are unreliable or underreported, and we also know that a single negative test does not mean you are not going to get COVID. That's why we have to look at the positive tests, because that gives us more information about the burden of illness in the community and how the virus is spreading. How is China going to help Mobile? Just because they have a decline, does it mean we're all in the clear? They made everyone stay in. Yes, China has some very different social, political, economic situation. That whole fabric is different than in the United States. What we sometimes do is compare, make comparisons between what's happening within different areas of the United States, or potentially comparing what's happening in the United States to another, free country like Italy or Europe, other places that have more similar political structures, economic and social structure than China, since we are very different from them, and it's somewhat challenging to make comparisons. More vulnerable than just those healthy. The vulnerability increases the more we are closed as a community. Is that even being considered? Yes. We know that physical separation and isolation of people away from their workplaces and their families and their retail establishments and their barbers and their nail salons has a negative impact on people's well-being, on their mental state. And we are aware of this, and it is something that we talk about when having conversations about, is it time to begin lifting public health restrictions that are in place to slow the spread of coronavirus. But because our entire population has no immunity, no prior immunity to this coronavirus, we still believe that it's the right thing to do to try to protect our community. When we have a vaccine and we can get vaccine in a large proportion of people, then we'll feel better about lifting restrictions. Or if we're able to relax restrictions in a phased or stepwise fashion and see that there's no effect on the rate of cases around our community, then that will be important information. But yes, everyone's mental health, economic well-being, their social wellness, their mental wellness is important, and something that is always a part of the conversation. Would it be safe to have high school graduations outdoor in June or July? I can't answer that question now. I think we have to get closer to June or July before we can say that mass gatherings can continue again. We started with just saying, no mass gatherings over 25. I think it went 50 and then 25 and then went to 10. So you may see it open back up in that stepped approach, rather than just saying, okay, now everybody can go back to having mass gatherings and have fun. But because we really don't want to get ourselves back into a scary situation by just lifting everything at once. Do you think we'll see a peak later? Probably. We may see 2 additional peaks over the next year or 2 years. So history has taught us that when we have a new virus like this, that we likely will see a second and maybe even a third wave. We just hope that the things that we're doing will keep it from being so that it's smaller than what we are currently seeing. All right, let me read a couple of things from CDC today. One is, should I travel within the United States? This is something that we have not been talking about for many weeks. It's about travel restrictions. So this is information from CDC. Don't travel if you are sick or travel with someone who is sick. So, travel increases your chances of getting and spreading COVID-19. So, stay at home as much as possible, especially if your trip is non-essential. And if you do have to travel, practice that social distancing. Don't travel if you're sick, especially if you're 65 or older or have an underlying health condition that's going to make you more vulnerable to severe complications. What is the difference between essential errands and essential travel? Here are some things that are essential errands: grocery shopping, getting a delivery or takeout food, banking, getting gasoline, going to the doctor, or getting medicine, or providing direct care to a vulnerable family member. So the ways that you can do this, if you do have to travel out of your local area, so if you have essential travel, some travel may be essential, like providing medical or home care to others, or traveling as required for a job considered to be an essential service. So those are some examples of essential travel. And let's see, I have a couple of media questions, Mark, that I'll try to address now. So do we know what the R-naught value is for Mobile County or Alabama? And do I agree with some Stanford quote in an article? So yeah, that article quoted the estimated. Let me first say what an R-naught is. So R-naught is the reproductive number. So every agent, every transmissible agent that causes a communicable disease has an R-naught estimated, or the reproductive order. And what this calculation does is it determines how many more people will get infected from one infected person. So for coronavirus, it's been estimated that every one person would infect 2.5 to 3 other people, which is higher than seasonal influenza. We don't have any Alabama-specific or Mobile County-specific data on that, but I do support what the Stanford University opinion article said, that it's estimated in the U.S. to be around 2.5 or 3. I already talked about the difference between a death rate and a mortality rate. They're pretty much the same. It's just the way we look at the number of deaths over a denominator, either the number of cases or the number of population. Let's see. A few more questions on, if Dr. Eishold is going to be making recommendations on reopening the city. As I've mentioned before, the Unified Command, which is the health officer, the mayor of Mobile, and the Mobile County Commissioner, they are talking daily, multiple times a day, to have these discussions, and there will likely be guidance from the governor and the state health officer in the next couple of days. So please stand by. In Mobile County, we will continue to, use our perspective in those conversations about really needing to protect the health of our community members. That's what we bring to the table, is that perspective. And then we'll, rely on leaders, political leaders, community leaders, business leaders, those folks to bring to the table their expertise as well. Here's a question on, can you give us the latest on any additional case clusters? Yes, I said last week, and it continues to be true. We have cluster investigations going on at 7 congregate setting, 6 long-term care facilities, and 1 detention center. We're talking with them daily, multiple times a day, to try to make sure we support them in decision making, in interpreting guidelines, just any way that we can, getting PPE to them if we can find any, making, helping them make decisions about, testing their employees and their residents, all of those things. So we are in super close communication with those. And the 31 long-term care facilities that do not have COVID patients, we talk to them also generally by email, weekly, or sometimes a couple times a week if we have more information to share with them. So we are very concerned about additional clusters in congregate settings like long-term care facilities, and we'll be continuing to keep a close eye, because once COVID gets into a nursing home or an assisted living or a senior citizen apartment complex, it's very difficult to control spread once it gets in. And then the last question here was somebody calling me out on the mat. Last week I said that I would have data on recovered patients. Yes, the data, we finished calling everyone that we could on Friday. The data, our case investigators are trying to get our database updated with that information, and as soon as that data entry is complete, I will run those numbers and try to let you know. Anything else, Mark?
Can you please have the information on hospital bed utilization and occupation rates in general and for COVID-19?
Okay, so the question was about hospitalization rates, so how many beds available, how many vents available. Yes, that information is made available to public health authorities on a multiple times a day basis. Hospitals enter that information into the AIMS system 3 times a day, and we have access to that information. We can't provide the individual facility information, but as a whole, Mobile County hospitals are doing fairly well with their bed count and their ICU count. Right now, they have plenty of availability of hospital beds, of ICU beds, and of ventilators. So that's about all I can say about that. Anything on Facebook? All right. Sounds like that's it. Remember, this week we will be coming to you at 2:30 on Monday, Tuesday, Thursday, and Friday. Wednesday, we will defer to the Unified Command press conference. So we'll see you tomorrow.
This has been a Fox 10 News Coronavirus Update. For the latest breaking news, stay with Fox 10 News on air, online, and on the Fox 10 News app. We now join our regularly scheduled program already in progress.